on my watch. I have workout. And I try to.
Hey, welcome to Physical Therapy and Balance Centers. We're about to get started with our live event. Thanks for coming. We're going to be broadcasting live and recording it. Help for neuropathy sufferers. So stay tuned. We're just going to make some adjustments here, and we're good to go.
Classy.
Okay, we're going to get started because we, want to be in respect of time. I don't know if more people will come. It would be awesome if they do. If not, we're here for you, and you are most important. Welcome to Physical Therapy and Balance Centers. My name is Gina Royal. You know me, you know your daughter, and I know you too. So, our first speaker today is going to be Lisa Shore. She's from Lumen MD. She's going to go through about a 30-minute presentation on neuropathy and educate you on it. And then I'm going to speak to you about some of the things that you want to avoid physically when neuropathy comes, and some of the things that might be scary to you. I'm going to kind of uncover them. And then we're going to have Dr. Weingarten come up and talk to you also and answer any questions that you might have about your feet and knees. Okay? Welcome, Lisa, podiatrist.
And what were your names?
I won't be here that long. I might have to leave early. I just don't
Helen,
look
hi, I'm
quiet.
Lisa. Hi, I'm Lisa. Nice to meet you, ladies. And this is Jill, and Jill works with me as well. She's a physical therapist. So my name's Lisa. I'm a nurse, and Jill is a physical therapist like Gina. Yeah. And I'm a nurse. There we go. And our goal is to just talk about some of the current ways that people are being treated for peripheral neuropathy, about what infrared light therapy is. We're going to introduce that to you today, how that and physical therapy can work in conjunction, a little bit about the program, and then any questions and answers. And we're a small group, so any questions you ladies have, feel free to just chime in. Baseball and tennis and enjoy the nice weather, but oftentimes when you have peripheral neuropathy, that really can have a negative impact on what you're able to do. And so we wanted to offer you some solutions this afternoon. Over 20 million Americans, some of the data Jill and I have seen say closer to 25 to 30 million Americans have peripheral neuropathy. And what is it? I think these two pictures do it really a good justice. Either the pain and burning, tingling sensation, bugs crawling on your feet is how some patients describe it, or pins and needles sensation, or also decreased sensation where you're just not feeling your feet or your fingers. And it can be cancer, it can be deep. And what the causes are tend to be, number one is diabetes, also pediatric chemotherapy, alcoholism, different types of chemical exposure, genetic in nature, and then idiopathic, which means we just don't know why certain people get it. And what we're going to introduce you to is a drug-free, pain-free, FDA-cleared therapy to offer relief for peripheral neuropathy. And there are 6 stages of neuropathy that clinicians will talk about, going from 1 to 6, 1 just being your feet are absolutely normal. But what we tend to see patients in is the second category to the fourth category. And the second category, as the slide shows, is pretty minimal. You might have some intermittent tingling or some pain. The second one is that tingling and numbness. And it can feel like the bugs crawling on your feet. And then the fourth is moderate, where you can actually have a lot of pain in the bottom of your feet, burning, trouble sleeping, like that restless leg feeling. The 5th and 6th stages are much more severe. The 5th stage is where I might step on a nail outside and not even realize that I've stepped on it because I've lost so much sensation in my foot. And then the final stage is a critical stage. That's where we start to see muscle loss. You can oftentimes bones can even be exposed, so that's your most critical stage. And what the doctors or the staff will oftentimes say is, where do you see yourself right now in terms of peripheral neuropathy? And if you don't do anything, where do you think you might be a couple of years, down the road? How peripheral neuropathy is currently treated is oftentimes with medication. Lyrica, gabapentin, also pain medications for patients who have a lot of pain. Oftentimes diet, there can be suggestions made about diet. acupuncture supplements. Oftentimes we see B vitamins, that sort of thing in many of the doctor's offices. And then also there can be physical therapy used with infrared light therapy or without the therapy. And what the research is showing is that using light therapy in conjunction with physical therapy tends to give us the best overall results. And Gina's going to chime in on that, the physical therapy perspective. And what is near infrared light therapy? I'm going to show you a video in just a minute, but I think the thing that's interesting is 3 physicians got a Nobel Prize in 1998 for discovering that what infrared light therapy can do is it can signal the release of nitric oxide into your bloodstream, which is your body's most potent vasodilator. So when you hear the word nitroglycerin, that's a form of nitric oxide, but that you're taking orally. What we're talking about is light therapy that is directly put on the site where you want the vasodilation to happen. And you'll see in the video that I think it does a good job of explaining how the light therapy increases your circulation and also the potential for healing of wounds. So I'm going to go ahead and show you that. Okay.
At the basic level, all cells in the body have a miniature power plant within called the mitochondria. This is where our cell's energy is produced. The technical term for this energy is called adenosine triphosphate, or ATP for short. ATP is formed from oxygen and glucose, both of which are carried to cells by blood flow. Patients with neuropathy often have decreased blood flow, which means all cells, including nerves, are not receiving adequate amounts of oxygen and glucose. Therefore, the mitochondria cannot manufacture normal amounts of ATP. Nerves, most commonly in the extremities, sense this lack of ATP production by sending pain signals to the brain. In some cases, a lack of sensation rather than pain is the chief symptom, and this is the main reason for falls. Because the mitochondria are very sensitive to light, infrared light therapy can stimulate ATP production in the mitochondria. That is, if the nerves receive glucose and oxygen through increased blood flow to the nerves. Light energy stimulates the release of nitric oxide from hemoglobin into the bloodstream. When nitric oxide is released from hemoglobin, it enters the muscle cells in walls of the blood vessels. Muscle cells relax as the blood vessel diameter enlarges, allowing more blood to flow through the vessels. Increasing nitric oxide levels in the body offers a host of benefits. These can include anti-inflammation. Inflammation occurs when oxygen levels are too low, so increasing blood flow via nitric oxide reduces inflammation. Tissue regeneration. Tissues that need to heal require oxygen, nutrients, ATP, and growth factors. Nitric oxide provides an environment for enhanced healing. The key to accomplishing this? Better blood flow. Pain reduction. Pain occurs when oxygen levels at the nerve are too low. Think of how painful your finger becomes if you wrap a rubber band around it. The rubber band cuts off blood flow, thereby depriving nerves and other cells of oxygen. The pain recedes when the rubber band is removed. Increased localized circulation. Nitric oxide is increased locally when light energy is applied to any specific site. Along with it, blood flow increases at the same point. Light is composed of photons. Photons are quantum units of energy. A photon emitted at a specific wavelength or color contains the same energy irrespective of the source. Light near the blue end of the spectrum penetrates about 2 to 3 millimeters. Light at the red end of the spectrum penetrates about 8 to 10 millimeters. And near-infrared light penetrates about 20 to 100 millimeters. Near-infrared light is more energetic than visible light, less resistant to reflection and absorption, and therefore penetrates soft tissue to a deeper level. These are generalizations because the more red cells with hemoglobin in the path of the photons, the shallower the depth of the penetration. Remember, hemoglobin absorbs the near-infrared light energy, thereby releasing nitric oxide. The net result of light therapy is a cascade of beneficial chemical reactions throughout damaged nerve cells that stimulate healing. This response can be directly attributed to increased blood flow. This enhanced, localized blood flow improves tissue oxygenation and therefore plays a role in the following. Improved sensation, which offers better gait and balance when walking. reduced pain, which can allow for better sleep at night, as well as reduced burning and stinging sensation in the extremities, increased oxygenation, which acts to reduce inflammation, and finally, increased circulation, which offers the body decreased wound incidences and shorter healing times.
And I'm gonna just plug this in and show you that this is the infrared light therapy that we're talking about here. And you just press a button and it turns on, and these are hand pads, and that is a foot pad. And when a patient is using this, they just press the on button, and then the timer will keep it on for 20 minutes, and they can either use a hand pad if it's their hands that are bothering them, or a foot pad if it's their foot that's bothering them. And it comes in a couple of different combinations that I'll show you. But you're gonna see that there's two different types of light. The one that we can see right now is just regular red light. But then if you come closer, and I'll certainly let you guys walk up and see, there's a row that almost looks like it's black. That's the near infrared light that we're talking about. And if we use like a cell phone and held it up to here, you would be able to see what the near infrared light looks like. It almost appears purple. So this is two different spectrums of red light that you're seeing for people to use on their hands or on their feet. And in 20 minutes, this will just automatically turn off by itself. But I just thought I would turn that on so you guys can see exactly what we're talking about there. And this is a Doppler scanner, and what it does is it shows us the different levels, excuse me, just grab this pointer so we can see better. It shows us a pre and a post baseline for patients who, this is your before and this is your after 20 minutes of the near infrared light therapy. So darker is less flow, light is more flow. And you can see for this patient, here's your before with not a whole lot of flow in the middle, and then after just 20 minutes, you're getting increased flow. The second patient, same situation, pretty dark before and then increased flow. And even for this patient who's probably like at a level 5, something like that, very poor blood flow, still got improved blood flow after 20 minutes. And so this is just to show you how you can actually quantify the effect that it has on blood flow.
Can I ask you a question?
Sure.
What happens if you don't do anything? You had them before, first before,
Right.
and you don't do any treatments like this to make the blood flow faster?
Well, and Dr. Weingarten can jump in on the end here too, but basically if you're not doing anything to make the blood flow faster, then it's gonna stay the same probably or get a little bit worse, because over time, if you're not, doing things and the disease process continues, then you're gonna get less blood flow.
And the nerves dry up?
Well, you could almost say like they atrophy, or that they're getting less, basically less nutrients from the blood and from the ATP. Yeah, so that's why you're seeing as the nerve is getting more and more damaged, you're getting less flow. Yeah, so that's exactly kind of what this is showing you. And this is not a brand new technology. It's been around, but now it has been greatly improved with the two different levels of red light and the fact that we've made it available for patients to use at home. When this technology first came out, we tried to use it in a clinic setting and say that patients should come to the clinic 3 times a week to get their therapy. And what we found is that the success rates are much higher and people are more compliant if they can do this in the comfort of their own home. So there was the original model when we started doing our clinical trials of patients coming into the clinic, and then subsequently we've changed it. And as they showed you in the movie, there's 2 different levels of red light, and what it's doing is increasing the nitric oxide and the ATP, which helps with the wound healing. And now the patients can use therapy 7 days a week, and oftentimes done in combination, in conjunction with physical therapy, like Gina will tell you about. And what we've done is the product is made here in the United States, in Chicago, with the best LED technology that's available, with the 2 different wavelengths. And I'll go into it a little bit more, but I love that it's a nurse who owns our company, so she's made it a very affordable way for patients to use this as a rent-to-own sort of device, not something that one has to, buy outright right away. And then they can use it at home 7 days a week. And the other thing that I think is making infrared light so much more popular is society is becoming more aware of how many medications patients are taking. And this is an opportunity to help patients in a non-invasive, drug-free way. So society, I think, is really embracing this technology as a great alternative. And Jill and I were just at a seminar last week, and one of the employees from Physical had started using infrared light for her peripheral neuropathy in her hands, and then was able to cut her medication, her Neurontin, like in half from what she'd been using before in a very short period of time. And like we had talked about the features of, you can use it at home. It's pre-programmed, so 20 minutes and it'll go right off. No drugs need to be used with it, non-invasive, no supervision needed. You don't need a nurse or therapist to help you do that at home. It's portable. It's FDA listed without any contraindications, manufactured right here in the United States. I'm going to show you there's 3 different ways and configurations that are available. And I put in this slide because this is a gentleman, one of our first patients, who showed me that he was at Disney World with his family and how easy it was to just fold up his little foot pads, put it in his bag, and travel with them because it's light. And so he was able, when he was at Disney World, to still use, his therapy and run all around Disney World. And here's the different configurations that you'll see. So there's just a single foot pad, one pad by itself. You could have dual foot pads, which are the 2 foot pads. And then what I have up in the front is the square hand pad and a foot pad, depending on what the needs are for the patient. Because some people have pain in their hands, other people in their feet, or some patients have hands and feet pain. So depending on what suits the patient best. This is a gentleman, one of our first people who was treated with infrared light therapy, and his name is Donnie Althoff. And I'm going to just let him speak for himself.
I started having symptoms at the first part of the year and stuff. My toes started going numb. The symptoms really slowed down my life. I couldn't do a lot of stuff, like playing golf and stuff. It just felt like I was falling over all the time. And, just took the quality of life away from you. I thought maybe I might even have to give up golf because I couldn't keep my balance very good. When I was sitting in a meeting, the feet were burning all the time. The doctor said, he said, I can increase your dosage. And that's probably the only way to really control the feeling and sensation of what you have in your feet. Maybe that would help you more. And then they said, just keep working on your system harder and harder, and it's not really that great for you. So there should be another cure. The gentleman told me that he was seeing it on the internet, that he was reading about stuff, and he said this might work for you. This aluminum, getting the relief right up front, right away. I mean, within the first few days, week, trying the appliance, it worked real well, and it was just a real stress release off of your. I've cut my medication in half. What the dosage I was taking. My wife was really pleased, right up front, because I, told her, I said, boy, this feels 100% better than what I was.
It has given him more hope and a better outlook on things. Now that we have an answer with Lumen MD, I feel great because he feels better, and that makes me feel better too.
Standing at, the swing of golf club was really a chore. I wanted to play with my friends and stuff, but when I'd swing, it just felt like I was falling over all the time. And, I couldn't hit the ball very good. Now I'm starting to score a lot better. So, yeah, I'm very much back to life. I live real active, and I enjoy the community and doing everything I want to do. I would recommend it, which I have, and already I've had 2 or 3 people contact me on the phone about it and ask, what kind of relief I was getting. It's really helped me, and I told them that the burning sensation was gone. So it worked well for me. I hope it works good for you.
And Gina is going to talk to you more at the end, is how she wanted to do about how physical therapy is used in combination with the infrared light therapy.
May I ask you this one?
Sure.
Is there a downside?
A downside? Jill, you mean in terms of
Yeah, no matter what medicine you take today, there's something that.
There are side effects.
Right.
Well, I mean,
That's what I'm wondering.
Jill's a physical therapist, I'm a nurse. I'll say the thing I like about this is it doesn't have any contraindications. So, you can have a stent, you can be on blood thinners, there's no medication that if you're taking it, you cannot use this infrared light therapy. So, I think that's the beauty of it, is that there's not a contraindication, and you don't have to go up to higher and higher doses to make it work. Most of the patients, when they start out, will use this twice a day, like in the morning or in the evening at their convenience. If you want to have it while you're drinking your coffee, and then have it in the evening when you're watching the news, or however you want to do it. Most patients for the first month will do it twice a day, and then they'll go down to once a day. And then we're kind of seeing, once patients get relief, some people, the owner of our company is like, when I get relief, then I just completely stopped using it. Other people are like, you know what, I still use it a couple of times a week just because it's helping your circulation, So there really, to me, I think that's the beauty of it, is there really isn't like a contraindication for it, because you're right, for most medications, if you Google it, you get a couple of pages of contraindications. So I think that's one of the nice things. Jill, is there anything you?
No, I don't think there's a downside. I think you answered it fine.
Okay. Current success rates are between 75 and 80% with the patients. We've treated hundreds of patients. That's the current success rate. And it depends on what the problem was that the patient had, that they presented with. Sometimes it's that they had decreased sensation, sometimes numbness. Most of the patients have been able to decrease their pain medication or their Neurontin. So then they're able to increase, with less pain and better balance, they're able to increase their activity level. That's one of the big things we hear. Also improvement with restless leg syndrome. Hi, Jack. And I can cut you up at the end if you want.
Yeah, okay.
Okay, all right, so make yourself comfortable. And oftentimes patients have described after they've used this light therapy less tension in their fingers or in their toes. And some chemotherapy patients have said that they went back to having regular sensation. So those are some of the success stories that we've heard about. And how it works is, you saw that there are 3 different configurations available: a single foot pad, a double foot pad, or a hand and foot pad. And like I said, in the past, this was a product that people had to buy outright, or they would come to a clinic and use. And now the way that it's set up is that it's a lease to own product. So a patient can decide they want to use just the single foot pad. It's $180 a month, and after 6 months you own it. The other thing I just love about it is, if for some reason it didn't work for someone, they tried it for 2 months and they're one of the 20% that did not have success, then you put it right back in your box with a return with a return sticker on it, and you send it back to us, and then we don't charge you any further. So I think it's really nice, because somebody doesn't end up with something that's not working for them that they're stuck with. And the owner of our company, who lives in Tequesta and up in the Chicago area, thought that was a really important feature, is to make it very patient friendly. And because you all are here at the seminar today, what we've made available is that you can try it for actually 2 months for just the $180 or the $230. So it's a second month free to try it. And then, you'll know after 2 months if you've had success or not. If you have, you can continue on with it. If not, then, you just had the one payment that you've made. And we can talk to you about that more. Gina is also going to talk to you about physical therapy and how that's used, the light therapy and physical therapy in combination. And I think, Gina, then from there, yeah, I'm gonna have you take over with the physical therapy aspect, please.
Okay, wonderful. Thank you. Thanks for taking some time out of your day. Do you mind if I just?
Do you want to either shut it off? Yeah, absolutely. That'll make it easier.
Thank you. So Dr. Weingarten was here, but he got called away. So he left this couple of studies of some things that he could do. He's a local podiatrist up on Indian Street, but just if this didn't work out, or if there was another option, he wanted to leave you some studies on it. So I'm gonna let you take that with you. And then I'm just gonna move right on to the physical therapy side.
Oh, yeah, that's fine. We can just get it right out of your way.
Yeah, okay, so want to start with a couple of stories because I like to just kind of make it real. But this was a guy I treated a long time ago, but he had severe neuropathy. Do either of you have neuropathy? You do. So you know that it's kind of progressive, unfortunately, if you don't have an intervention. Well, technology are just like rapidly changing. Advancements in the holistic realm are becoming available pretty quickly. So this would be one of them, although anodyne, the infrared light, has been available. Well, when he came, his neuropathy had progressed over about 10 to 15 years to the point that he really had to compensate. And I'll leave this here. You guys can look at it later, but read the story. It was a good story. He got a lot of really good results just from the traditional physical therapy, which is very hard to do without some additional intervention. So he would walk, he'd have to walk where he locked his knees down, right? Because as it progresses and goes up the leg, you have to find other ways to balance and give your body cues. So he needed some lost strand crutches, and he would just kind of walk like this. But he was falling down a lot. And through therapy, what we were forced to do was retrain his brain so that his hips were giving him the signals that his feet should have been. And that's a big jump to kind of retrain the brain like that. And it was a lot of therapy for him. But he did really well. What people tend to do when they start to loosen, see, you have 3 balance systems. Your 3 balance systems are your eyes, your ears, and your feet. And when those 3 balance systems are functioning well, you can just move around without a thought. You can step off a curb. You can do whatever you want. You can function really well and compensate for it if you're missing 1 of the 3. But 2 of the 3, then the world becomes a very, very unsteady place. And people start to, the biggest thing that people do is they start to give up the things they love in life. And then that is probably the most disastrous thing you can do because it just kind of creates a decline that goes spiraling down where you start to get a little depressed. The onset is as soon as you stop to lose your feet, you start to ask for your eyes to do all the work. And then what you end up starting to do is just really watching the floor when you're walking and relying completely on that. What that does is the inner ear being your main balance system, it weakens it. So now you have 3 systems that are weak, and now you have to kind of come back to it. I had a neurologist call me from town. He called me, he said, Gina, if you buy an anodyne infrared unit, I have a lot of neuropathy patients that I would like to send you. So I said, sure, I'll invest in one. Problem with that is that you have to come to the clinic. You have to take time out of your day. You can't usually come every single day or twice a day, which is what's really recommended when you have a home unit that you can treat yourself twice a day, and it's much more rapid. But the first time, and I wish every result was like this, the first patient I put it on, he came in, it was the very first time, he came in with his wife, and he was walking like this. Man, because what do? We can't feel our feet. We start to be afraid of falling. We lower ourselves down to the ground because we figure it's a little more stable here. Whatever we can do to create stability. Well, he sat down. I put the unit on him. 30 minutes later, he got up. He stood straight up and walked out into the waiting room. And his wife was like, "Oh my gosh, you're doing the dishes." I wish every result was like that. I didn't have that result, after that, but it did help, and it helps people. As she went through the stages, it really helps people who are, not so far progressed as the guy I show you in this picture, but, where it's starting to really be obvious that it's a problem for you. Then it makes sense. Neuropathy is a lack of circulation to the small nerves that starts to have at first the sensory nerves start to die off, and you start to get the odd feelings, tingling, numbness, burning, pain. And then that will progress on to even so you have the motor nerves that get involved, and then you have some foot drop. So this is a great, great modality and a great solution for people at home who want to just treat themselves at home and get the relief. And I would highly recommend that. In conjunction with that, what you do is physical therapy will change the mechanics. We start to, when something doesn't work, we start to compensate. And what I find in physical therapy is that the compensation side of what we do to correct for something is usually what people have more problems than what they're trying to correct in the first place. So that's usually when you compensate, use your eyes, and then you start to lock your knees out. So you start to do some wear and tear on the knees, start to change your posture, all the mechanics start to change, and you don't want that. You don't want to allow that. So what we do in therapy, in conjunction with you guys treating yourselves at home, is get you a little bit more aligned, take away some of those compensations, especially challenge the inner ear vestibular system so that we remove your dependency on just your eyes, because eyes work for so long until something there is not reliable. And if you hit something not reliable, and it's a startle, and then you're at a higher risk for falls. So that's our presentation. Do you have any questions?
I like this.
Yeah.
My problem's neck problem. I had my neck operated on 9 years ago with a fusion because my arm was numb. And Dr. Ashar, neurosurgeon,
Very good one.
yeah, they were going through the neck, did an operation. And I got along good up to a few months ago, and it started bothering me again. It locked up on me.
Mm-hmm.
I'm fine otherwise, but I was sent to the pain management, and oxycodone don't work for me.
Good. Lucky. Because if it did, you have a
I went
different
about
problem.
2 months, and I couldn't take that stuff. It didn't do anything for me, really. Just upset my stomach. So that's the reason I came. I called Dr. Ashar, and he said, I recommend you go to physical therapy. And I just had my first, what do you call it?
Laser.
Oh,
So
laser.
the laser is the same
laser.
similar technology, but the
The
laser
laser.
is kind of like these lights, which for this diagnosis need to be delivered over a period of time. Where the laser, we can kind of turbocharge the laser and deliver a lot
Yeah,
of
the
light to a
laser's what
smaller
I have.
area.
And it's already helped me, I can tell.
Oh, thank you. Awesome.
And that was my main trouble. I don't have any other trouble.
Well, good.
My brain, it doesn't function as well as it used to.
I think you're doing pretty well.
How long after you use the machine does the blood continue to flow at a good rate?
About 20 minutes, Jill, isn't that what we heard, 20, 30 minutes?
I think she's asking, or you're asking over long term. People tend to get results anywhere between 2 and 6 weeks of starting the treatment. So you don't always necessarily end up like the patient Gina was referring to who stood up the first time
Right.
after
Right.
treatment. That's not, it depends on how far progressed your disease process is. But so once they start getting results, if you're utilizing it, the nitric oxide is absorbed in the body within 10 to 15 seconds, but that's why we're promoting it locally to the area of the hand or the foot to try to solve the problem locally. With continued use, you should get beneficial results. The effects.
But at a certain time after you get off the foot machine, it will stop until you use it again.
Well, you're kind of building it up through time as you use it day after day. So, you may not see the results at first, but you should get to the point where you potentially could go off the machine or on a maintenance program, as Lisa mentioned. So.
And I think if we were looking at Dopplers, you would probably see, some progress the first time, and then if we looked at it, a week later, you should see that more areas lighting up with more flow. So,
Without using the foot,
well, it's,
that again.
I mean,
It's a it is a symptomatic relief, whereas what Gina can provide at physical therapy is for, you know, the structural deficits of the balance and gait problems. So this is symptomatically to increase sensation and decrease pain over a period of time. So some patients go off and stop using the machine, and then they need to be back on using the machine again. That's why it's a good program where after the 6-month period, you actually do own it at home. You know, if the symptoms return, you can go back on the unit. So there's no direct answer one way or another that if you do it for 6 weeks, it's going to last a lifetime, you know, because you still have comorbidities and disease processes going on. So it's a symptomatic relief, but it's to be able to get you into somebody like Gina and then get your functional level back so you can manage and, you know, out in the world and do the things you want to do.
Is there a chance of getting the blood going in your feet after that? So what I'm getting to is I voluntarily, because my doctor suggested it, gave up driving, which has been a real hardship.
Oh gosh,
believe
yeah,
me.
that's hard.
And I'm just wondering if with the machine, if the feeling comes back in my feet, because there is numbness can be.
It could be, and actually, I know one of the patients that Jill and I met at another seminar said that she really was worried about driving because she just couldn't feel the steering wheel that well. She couldn't really feel, but it was her hands that were her problem. So, you know, there certainly is the potential that you'll get the flow back and you would get feeling back in your feet.
I could always jump on the machine before I want to go
Well,
out.
No, well, some of the studies that we have shown that the insensate spots that you have actually return with
Is
sensation
that right?
after a period of time. So there is the potential. I mean, it's probably little steps at a time. In your case, if you've already given up that level of function, you know, it probably would take more time to get back to that point. But yes.
If you could imagine a little plant, you know, if you didn't give it any nutrients whatsoever, if it was, or it couldn't receive any nutrients, but you left it alone, right? It would just continue to die and continue to just decline the plant. But if you had another little plant that you were able to just kind of drip nutrients to, that plant is going to start to recover. It's going to start to mend what's broken, shed the dead leaves, and it's going to start to grow. You can imagine the lights on you, basically, they turbocharge the cells. So if cells can only move to go get, you know, the material to repair, and then the cells that take the dead debris away, if they only move maybe at this pace, and they're really having trouble getting what the nerves need as far as nutrients, and they're just really kind of sluggish to take away all the dead debris like dead leaves on a plant. The lights go on. These cells are turbocharged. Now they're like, it goes right into the mitochondria itself. So they're kind of like turbocharged. So now they're running around 200 times faster, pulling stuff away, bringing stuff to help, you know, almost like a rescue inside your feet for the blood circulation. So, and as that healing goes on, it's not a one-time thing. But you're gonna, you know, you put the lights on again, and then it's like you're dripping some more nutrients into what needs to be fed.
Yeah, well, that's a good analogy because you can like actually
Yeah, that's how
see
my
it.
brain
Yeah.
works.
Yeah. And that's what they were kind of showing you in the movie, just, you know, that you're getting healing from the increased blood flow.
Do you, like Tylenol? I've heard you could take like 4,000 if you
2,000
need it.
2,000 is kind of the most of Tylenol,
Is it?
2,000 milligrams you want a day safe.
I mean, I don't know if I'll need it.
Yeah.
But I had a pharmacy tell me that.
Up to 4?
Yeah.
I know, in the hospital, we usually said 2, but you know, people.
Well, I don't mean I'm gonna do it every day, but I mean, my trouble is some days it works and others.
My bias is always and will always be whatever you can do that's holistic, non-invasive, not medicinal.
Yeah.
That's always the best for
Oh,
the body,
yeah.
because whatever you introduce, your organs are getting taxed
That's why I'm
and
very
it's disturbing other processes.
And I'm
You're
coming
smart.
tomorrow and get another treatment.
Yes.
I mean, I live right here. I don't have nothing else.
Okay, you can come every day, you know.
So,
We'll work
I
it
don't really need
out.
the machine objective.
It's funny what you said because
Yes.
I did a couple, contest preps for like physiques and, doing a physique. There's like a physique show, and I had my blood work done by Dr. Gage, and he told me that I actually had a mild strain from just, like training. Like I wasn't even, doing any bad supplements or anything. And I was like, oh, wow. Well, I think I have to be a little smarter with my training. And obviously I kind of have like a lot of caffeine. So I was like, okay, I should limit that. So it's funny. So, yeah, we all have to make adjustments.
It's all chemistry. And then the other thing that they've come out to, that we have in the clinic, that if you were to come for physical therapy, is it's called a hypervibe. So we'd have to screen you. There are some contraindications, but it just gives some vibration. It kind of enhances your workout, and then while there's some vibration, bringing even more circulation and getting other things, motor neurons to wake up and control the feet a little bit better, you're actually strengthening the other muscles that you need in order to compensate as you go in the correct manner for what you don't feel in your feet.
Dr. Gage, been here a long time.
No, I know. Yeah, I went to high school with his son.
Oh, yeah? I'm a funeral director and embalmer,
Oh, really?
so I know a little about anatomy.
Yeah, I usually just, like go with my dad because that's his doctor. So
We have a question.
Oh, yeah?
Gina, does that have any indications as well for like osteoporosis or anything because of the weight bearing?
Yes, osteoporosis. I have them up here, and if anyone wants to try before they go, I'll be happy to. It's circulation, osteoporosis, enhanced strength training, balance. It has a lot of really just, and I guess because we live in America and everything we want fast, we're coming up with technologies that are delivering stuff fast. So that's it. When you combine the vibration and the tilt, and it delivers a strength training and for faster than you could get if you were on the floor.
How
cool.
Hypervibe,
How long is the treatment on that?
5 to 10 minutes, depending on the circumstances. Now, if you wanted to get an athlete, they can go up to 20 minutes, and they can get a whole body. You can do the arms, you can do the neck.
Is it cardiovascularly tiring?
No, not so much. You feel it in the muscles. You try it too.
feels pretty good.
Palm Beach Gardens.
Oh, yeah?
I think if you have no more questions, that concludes our seminar today. There's still some food in the back, so and we're here. We're just hanging out. We're here for you. If you have any more questions, you want to try anything?
And I was gonna say, I'm happy to show you the light therapy if you like, if you wanna see it up close, I can just, it's plugged in. But if you wanted to be able to feel
Thank
it.
you for coming.
Yes,
Thank you for taking
you
that
so
out.
much.
Thank you.
Perfect. Oh, yeah. There we go. Thanks.
Huh? You want a sandwich or something?
Because I think
Yeah.
it's nice
Yeah, we
to
got it right
see that
here.
it's actually light, not
Here,
so
follow me.
you can actually